Step 46, progesterone support. This is also called luteal support. Reason being is in natural menstrual cycle, you have two phases in menstrual cycle. First 14 days is a follicular phase. After the ovulation is luteal phase, where you produce your own natural progesterone. This is why we call it progesterone support or luteal phase support. I will explain you what drugs you use, how you can store those drugs, and why you need actually progesterone support, and when you should start and stop the progesterone. In terms of drugs, there are three different types of drugs: vaginal, rectal, and injections. Vaginal drugs have two categories: pessaries and gel. In terms of pessaries, commonly used ones utrogestan, oripro, and endometrium, and gel is Crinon. And the cyclogist can be used vaginally or rectally. You can use injection of progesterone, for example, Geston, but generally it's not recommended for two reasons. One, of course, it's done intramuscularly and it can be painful, and it can also cause abscess because it contains oil. It doesn't get absorbed quickly, and also the progesterone gets clear going through your liver, and most of the progesterone will be eliminated by the time they reach your uterus. Vaginal or rectal progesterone gives you a lot of progesterone to the uterus because it's due to local absorption. So this is why vaginal and rectal progesterone is preferred route compared to injections. In terms of storage of progesterone, you can store the progesterone in the fridge until it expires, or you can also store the progesterone in the room temperature provided it's below 25 degrees until it expires. And why you need a progesterone? Essentially, the progesterone supports your pregnancy. In natural menstrual cycles, so after ovulation, the ovulated follicle becomes corpus luteum, and that produces progesterone. The first beginning of your pregnancy, that progesterone produced from the ovaries supports implantation. Then as you develop placenta, then placenta also starts producing progesterone. Then your ovaries will be producing less and less progesterone. Essentially, the beginning during implantation, the ovarian progesterone is the main progesterone you produce. So in the second trimester, the placenta produces most of the progesterone. In the third trimester, all progesterone is produced from the placenta. So because in IVF we shut down your pituitary gland, your pituitary gland doesn't produce LH, it doesn't stimulate your ovaries as well, and your ovaries will not be producing good amount of progesterone. That's why we need to give you additional progesterone and continue long enough until your placenta takes over the production of the progesterone. When you should start the progesterone? Different clinics have different timelines for starting. Generally, if you're doing fresh cycle, you should start progesterone maybe second day after the egg collection. Once you started the progesterone, you should continue until you do pregnancy test. Even if you have a bleeding, you should not stop the progesterone. You should do pregnancy test 10 days after the embryo transfer. If your HCG is positive, you should continue and repeat the HCG to make sure it's doubling every 2 days. If it is, then you should continue the progesterone until at least 7 weeks. So again, different clinics have different policies. Generally, you should continue until 7 weeks scan. When you have a scan, if scan is fine, then you may be able to stop the progesterone, and depending on your fertility specialist advice. If they feel that you're at a higher risk, then you need to continue longer, maybe 12 weeks until 16 weeks if you're at risk of miscarriage or preterm labor. And then essentially here you can see initially progesterone is produced from ovaries in IVF cycle, and then once you have implantation, progesterone starts getting produced from placenta. Then also you are using with the pessary. In IVF cycles, there are three sources for progesterone: your ovaries, your placenta, and pessary. Pessary always works as a backup in case your ovary is not producing sufficient amount of progesterone. In case your placenta is not producing sufficient amount of progesterone, the pessary works as a backup. Always there is a progesterone in the system to support your implantation and growth of your placenta and baby. This is why getting progesterone starting date and duration of progesterone is very important.